everybody. Welcome back to our Emirates podcast with Sara Mousa, where I speak to guests from across UAE about topics you want to hear about. Today, I'm joined by the fantastic Dr. Priyanka Sainani. Hi, Dr. Priyanka.
Hi, Sarah.
Thank you so much for joining the
How are
show
you
today.
doing?
I'm good, thank you. How are you?
Doing well too.
Awesome. I can't wait to hear all about your story today. So, guys, Dr. Priyanka is awesome. She is a specialist in alternative and holistic medicine. She is a really awesome physician, and she's also founder of Hygge, which is a really important digital health engagement platform that helps you predict and prevent lifestyle changes that you can help with your healthcare journey. Please, Dr. Priyanka, tell me your story and what got you started.
Thank you so much for that wonderful introduction, Sarah. Um, I primarily am a holistic physician, and I come from a family of holistic practitioners. My great grandfather was the first homeopathic doctors, and probably by the end of it, I might want to take all of their names just to kind of pay my tribute to them. But being in that environment, seeing my father, Dr. Aurobindo Banerjee, who was really my role model, my inspiration, my motivation, everything that I am today, I owe everything to him because the way he used to practice as a physician really motivated me in and out to just become like him. Because I've seen firsthand how he touched lives. I have seen firsthand how he has made such huge shifts into someone's health and not looking at the paying capabilities of a person back in India, making things affordable for people because that's what healthcare is supposed to be. And to be there for those people and to be there for everyone alike is something that I've learned from him. So truly, being in that environment, learning every single day how preventative, proactive lifestyle and how holistic approach can really build that sustainable health for us, our children, our family, the community, and so on and so forth is what has really motivated me to come thus far and to do what I'm doing today. And of course, I also, was inspired largely by my mother, Mrs. Sandhya Banerjee, who was a yoga practitioner. Her father, my maternal grandfather, who was a yoga practitioner too, and also an Indian classical music teacher. He traveled all across the globe. He ran his yoga and music schools in Brooklyn, in Vancouver, in London, back in the 80s, late 70s and 80s. So I think that kind of also motivated me to pick and take these important learnings realistically, practically, and imbibe that into not only personally but also professionally. And hence I joined a school to learn alternative medicine, specializing in homeopathy. Spent almost 15 years now in Dubai practicing with market leaders like Emirates Hospital Group, the Children's Medical Center. I currently practice at Rose Biohealth Clinic and the Holistic Healing Medical Center, both of them being, robust market leaders, believing in the very thing I believe in too, which is holistic approach towards health and sustainability. And with that mindset, I've also been extremely, like I would say, driven into one of the key gaps that we have in life, and which is investing time into the most cost effective daily routine lifestyle practices, which goes amidst the busy schedule that we have with work and friends and family. So I wanted to also do something into that space. Within the consultation room, I used to meet patients every single day, and I would always advise them that, hey, look, you have these things, and you want to improve your cholesterol, you want to improve your hypertension, you want to improve your pre-diabetic situation, and you can't be on meds all your life. You're very young. So what are we waiting for? Why are we not spending some time exercising? Or why are we not planning meals that can actually, on the long run, help us improve our wellness? Why are we not focusing on these important aspects of health that would basically circle back to us benefiting only and taking us probably off these, unnecessary medications? So it was always such a challenge to make that happen for them. And as a physician, I'm honestly not just writing prescriptions. I'm really invested into them. I want to make that change happen for them. I want to help them get onto that roadmap that I think is ideal for them. And that wasn't happening. Every time the same story. I know I want to do it, but I just don't have the time. I'm going to start soon, Dr. Priyanka, I promise you. So that just kept on happening. And then slowly something happened back into 2016 when I was approached by one of the biggest insurance broking companies, asking if I can help them develop wellness programs for their client organizations. And I said, well, I think this is just a universe calling me to get into something that I'm interested in. And I graduated with the post-graduation back in that time with community nutrition. So I immediately, got into working with them in and out, working with big organizations such as, Dubizzle, Healthy, Natixis, to offer them wellness, talks and seminars, and really working with them and their people to identify the gaps in their health and what kind of lifestyle changes should they adapt to. So that continued with my practice. And by 2018, I understood the further gaps that there are, because there was no visibility for these organizations as well to what was done, what are the issues within the companies, what kind of changes should they implement, why do they want to run, let's say, a mental health camp, why not, let's say, a quit smoking camp, where do they get that information, how do they understand what their employees need? And then once they run any such initiatives, how do they understand the impact? How this specific program has helped their organizations and their employees improve their wellness, because now they have invested efforts, money into these kind of initiatives for the past 3 months, 6 months, a year maybe, how they have made things turn into the positive direction. So there was no visibility, completely blindfolded into just doing as and when whatever that they felt was right. So I wanted to bring that visibility. I wanted to help them understand what should be their focus. I wanted to help these organizations understand, well, now that your focus should be on what are the burden percentages for all of these areas? Like, how many obese people do you have in the company? How many men and women do you have, firstly, in the company? How many women are going through the perimenopausal situation? How many of them are struggling with stress? How many of them are not able to sleep well? How many of them are not able to understand that alcohol is not the solution to stress? So, there's so many things that they actually understand now because of Hygge. So that's why we created Hygge. And now we're working now with insurance organizations, insurance companies, brokers, to help them really do all of this in a much more structured manner. And so years after years, with the support of Hygge, they can now historically also understand how the ecosystem was, how the ecosystem is today, and what kind of support has benefited them back in that time, and should they go back to doing that because that really supported them. So now complete visibility is there for them to really make informed decisions, informed choices, help their employees without breaking the confidentiality of any person, without knowing anyone's personal health details. So, I make it a point that every employee within an organization is informed about this is important factor, that Hygge keeps their privacy intact, and the organizations only get an aggregate understanding of what's happening and where should they focus, where should they invest, and doing that, how do they benefit by improving their employees' health and wellness. So this is where I am today, Sarah, in a nutshell. And yeah, this is my journey.
Well, you've made my job a lot easier on this episode today. You've already answered all of the questions in such a beautiful way, may I add, just to hear your passion and the way that you talk about your journey and the way that you want to help people above all. Like you're bringing such a beautiful kind of wealth of generational knowledge from your own ancestry into the modern society by tackling things like perimenopause, like, alcohol abuse to recover from stress. You're obviously, people, as you said, people are super busy, right, in their day-to-day lives. So you're also helping them almost unpack the small steps they can take to prevent these things. And I'm curious now, you've spoken about some of the challenges that you've faced in your journey and kind of the different environments you've been in to get to know these people and their healthcare. Is there any kind of moment or kind of experience that you really feel resonated with you or made an impact on you throughout your journey?
I think, like what I was just saying to you about, instances where patients would come to me and they would share their stories.
Hmm.
Patients have really, really motivated me as well. When, for example, I remember one of my patients, she came initially for treatment of, I would say, severe seborrheic dermatitis. And she had some other multiple issues like fibromyalgia, IBS as well. And back in 2018, I just don't understand why nobody was talking to her about stress and anxiety, why nobody's, really tapped onto that side of things. And this is so commonly seen. As a practitioner, I have these conversations, in-depth conversations with women every time, and I make it a point that I discuss this. How are you emotionally feeling? How resilient are you feeling mentally? How do you think that space is holding up for you? And that always is in a very bad situation. And nobody's talking to them about this. Who would ask her, how was the time when you delivered your first child? And now she's a mother of four. Nobody asked her. Nobody tried to understand how she's managing everything. Nobody's trying to understand how her financial insecurities are taking a toll on her health. So I think I like to tap onto those aspects as well. And I think as a physician, we all physicians don't have time, and I understand that. Honestly speaking, we only have a limited amount of time. But for me now, I mean, with so many years of work and experience, and because I have that angle into my practice, which came from my father's motivation, of course, that I just don't want to write a prescription. I want to connect with this person who came to me today, who chose me out of tens and thousands of doctors that there are in Dubai practicing today. So I want to put that effort for this person now that they are here with me. So that's why I ask these questions, and I understand that there is more to just writing a prescription for a patient. And I think, these nuances were so important and really weighed down on me to understand the importance of creating a platform, maybe which can go into their working space. You understand? It's no longer their personal choice. Now it's a part of their working ecosystem. So sometimes that makes it easy to adapt to. So when you are a part of an ecosystem and that ecosystem offers you this support and service, then you're more likely to benefit from it than stand alone in silos. You're trying to do something for yourself. It's just human nature. So this has been really something that motivated me to practice in that way, to create Hygge as well, to look into my professional practice style as well as my work as a founder for something that I am so passionate about. Yeah.
Beautiful. I mean, the way that you speak with such, like, you really speak from the heart. The way that you describe Hygge, describe how you got to be at this point, like you harnessed all of your skills to help people in one really important digital platform and to do something that taps into things that we don't talk about every day as a society. We don't talk about anxiety as much. We don't talk about the stress that we feel from financial insecurities, for example. Like we don't talk about It's, for example, if somebody is referring to some form of influence to help them recover from day-to-day stresses at the office, and how to embed those practices in their daily lives. So it's really incredible to see you doing something like that is not only helping people but changing their lives. And this brings me to my final question for you today, Dr. Priyanka. For those listening today, for those watching today, what is one final message that you really want to resonate with them after watching this episode?
When I started, I was always very scared to start because I thought I'm not ready yet. And I think this is a common thing with most of us, which is very, very human again. I would only say that don't worry about that. You don't have to be ready. You don't have to be perfect to start. Just progress makes a difference. Just the small little milestones makes a difference. And as the saying goes, practice makes us perfect. So we cannot be perfect from day one. That's a myth. So whoever started at a stage when everything was perfect has started it really late. So it's best to start whenever you feel you want to. You don't have to feel ready for this, and you just can go on. And you would see that you would as you progress, you're acing it.
I love that. Thank you very, very much for sharing that, and reminding people that imperfection is okay as long as you take that first step to do something that you're passionate about. Founding your own company, putting your time and your energy into something that is good for the community and good for people and good for your own soul as well. That is such a beautiful message, and I really appreciate you taking the time to share your amazing story.
Can I just take a moment? I know this is something out of the conversation, Sara, but I really wanted to take all the names of all the doctors that has been in the family and who all have motivated me. My great grandfather, Dr. Beni Madhav Banerjee, Dr. Tarak Nath Banerjee, Dr. Arvind Banerjee, my father, Dr. Hemanta Kumar Mukherjee, Dr. Nikhil Kumar Banerjee, Dr. Mrinal Banerjee, Dr. Ram Ratan Banerjee, Dr. Lipi Banerjee, and my younger brother, Dr. Aditya Banerjee. Just wanted to say thank you to all of them to help me, motivate me, and to take me here where I am today.
I love that. And thank you very much for taking the time to honor them as well. I am honored that you got the chance to do that today. Thank you very much for sharing those names, even just with me, to understand more about who you are and the amazing person that you've come to be today. And I'm grateful that I had the chance to share your story.
Thank you. Thank you so much. Thank you.
Thank you.